All right. So, a timely topic. Let's talk about diseases or the globalization of disease. Oh boy, is this ever a current events topic? So, just to preface this, this lecture I had already made for a previous course, but I have added to it since because it is interesting to see where we were and what's coming. So, the most common in the far periphery is HIV and AIDS, malaria, tuberculosis, etc. Uh, HIV and AIDS is very prevalent in Africa. That's a big one. 1 in 3 adults is affected, and as we know, HIV/AIDS has no cure. There's no cure for that. It's a sexually transmitted disease, or infection, STI, and it is so bad. It's actually been declared a pandemic that affects a large portion of the population in many different countries at any given time. And there's a lot of ignorance and fear around HIV and AIDS as it is a sexually contracted disease just because of this. And the social response to HIV and AIDS is a lot of silence, stigma, discrimination, and denial of having it. AIDS itself is kind of an interesting story in terms of what and where it came from. It was actually unheard of for quite a number of years. They believe, again, this was a passage from animal to human, and then it's kind of spread from there. But it came to the US in the 80s, and it got a huge stigma around homosexual men specifically. And because there's no cure, it was killing quite a significant homosexual population within that time. So it was actually a crisis in the 1980s in the United States, and they ignored it again because it was affecting a marginalized group of people, homosexual men, and this is the famous AIDS, kind of this AIDS gate, and this is where this social stigma is. Now, it's not just because a homosexual man; anyone can contract HIV and AIDS. There was an issue with blood transfusions as well, and there's issues that you believe if you breathed in the same air you could contract it as well, which is completely ridiculous. That is not true at all. If you have HIV and AIDS, the only thing would be transmission through blood or, again, sexual contact. So HIV and AIDS has been a hotly contested topic for many, many years. And it is considered a pandemic, although it's not a super pressing one because it's not something that a huge number of people can get very quickly. For example, like COVID, because again, it actually can't be passed via transmission of air. So the problem behind the AIDS epidemic as well is it's kind of slow. You may have it without knowing it for years, and in doing so, you can actually pass it on. But it has had a huge effect on the African population. Life expectancy is going way down. Many children are being born already infected, which is basically a death sentence at this point. Millions of children are orphaned each year because their parents are dying young from it. The inadequate healthcare system just can't keep up with all of those infected. The economy suffers because they're losing young, healthy workers because of the epidemic. And it just kills adults in their prime. It kills even more because they don't have the health care system to support them a little to try and see them through a little longer. So what they're trying to do is trying to teach and end the silence and the stigma around AIDS. And this is called this ABC approach that they have: abstain, be faithful, and condoms. Empower women to be safer. There's unfortunately a huge statistics of rapes in Africa, and unfortunately the rapist is not coming with a condom. So it's a lot of women are being infected not wanting to be, and this is part of this as well. So better treatment, better care, and this is trying to get the message out to the African people. Up until recently, the biggest issue in old core, new core, near core countries was lifestyle diseases. And these are basically what we call obesity diseases. And you can see here there's a few that you can get: strokes, cataracts, obstructive sleep apnea, hyperthyroidism, fatty liver, gallbladder disease, gout, etc., etc., etc. And these all come with overeating rich foods and being overweight. So when we talk about these in terms of um, nutrition transitions, and we look at countries, stage one obviously is undernourished, fear of famine is a fact of life, so that would be the periphery countries. Stage two, not fear of famine, agricultural ideal weight range. Stage three is when diets change qualitatively and quantitatively. Many people are overweight. And stage four is on reduction of lifestyle diseases through medical intervention, government intervention, and individual behavior change. And we are at a stage four in a lot of the old core countries because America is hands down the most obese country in the world. They win at a lot of things, don't they? So as we can see by this chart, the 10 most obese countries in the world, although this is maybe a little out of date, I think it's changed a little bit. But the United States, of course, always winning. So pandemics. Oh my God, look at this. So this was my original slide. So the biggest pandemic prior to the current one was the Spanish flu in World War I in 1917. Erroneously named because it didn't actually come from Spain, it came from the US. It was an influenza. And in 1917, the United States finally joined World War I, and they took the influenza with them to the trenches of World War I, and it spread like wildfire because there was no hygiene to speak of in the trenches, and it just ripped through them. And 40 million people died. And we forget this because they were young, healthy people in their 20s, and they died very quickly. So it was a really odd time, and we forgot about it, but it did die out very quickly because we don't have the globalization we do now. Medical historians argue that there have been 32 major pandemics in the last 400 years. Prior to this, the last one I remember was the fear of H1N1 when I was in teachers college. People were running out to try and get vaccines. People were fighting in the streets over it, and that one kind of fizzled out. And then, of course, COVID. Welcome to 2020. A lot of you, I probably don't need to talk about this one very much. This is the global pandemic that so many people have anticipated for so many years. Generally, right now, there's still a lot of unknown. News changes daily. But what I can give you is a few facts here. It did originate in China. A bat-borne virus that carried into people due to consuming the bat flesh. And this is how it then spread. And it spread via saliva. And it spread very quickly. And while it doesn't kill as high, it does affect you quite a bit, and we don't know yet how much it's going to affect, and we don't actually know a whole lot about the disease yet. We are fighting to there's a race to a vaccine. Russia's actually started some experimental vaccines. Not sure I would want to be on the receiving end of those. But we don't know a lot, and we probably won't know a lot for years to come about this, but we do know that this is going to completely change our lives, and it already has changed a lot of your lives because now we're realizing that overpopulation problem is a problem because it's hard to go out, you have to cover your mouth if you go out, of course, wear masks and all that sort of fun stuff. So there's still a lot we don't know and that we probably won't know. So it's something to kind of keep in the back of your minds that this is the pandemic and you are currently living through history that I will no doubt be talking about in 10 years about, remember when I was your age, we used to be able to walk around and go to concerts together. So you're living history, kids, and you're gonna definitely remember this. So there's not a whole lot more I can tell you because there's not a whole lot more we know yet, but we do know we are in the midst of a pandemic and it's probably not going to end anytime soon. So sorry for that, guys. All right, that is it for COVID, and that is it for me, and I will see you guys in the next lecture.